Me in the studio now, and of course still practicing our social distancing skills, is Yuma County Communications Director Kevin Tennell. Kevin, thanks for being with us here today. You were in the studio with us a couple weeks back, and so great to have you here. Let's get right to it. A lot of talk going on about the potential idea of reopening the county. Now, is that even possible for us, and what would that look like for Yuma, especially since even just today, Governor Doug Ducey announced that elective surgeries could resume May 1st in Arizona. So what would that look like?
No, and I think you're absolutely right about asking it. Everybody's talking about it, and I think it's in the back of their minds. People are getting very tired of the whole stay at home. Governor Ducey did say that the stay at home order is coming up on its expiration, but said that there's a possibility it could be extended. He also gave 3 other options if it doesn't get extended. Those options, I think, are telling in what you were asking in terms of when are we going to get back to normalcy? When are we going to open up? I don't think even the governor knows that. There's too many things to think about. What I think we can be certain of is that it's going to be done as a graduated thing, and it's really going to include the public's involvement. In order for us to get back together at a sense of normalcy, they're going to open things very slowly, methodically. There's going to be restrictions. We're still going to ask people to socially separate and practice social separation as we go about this. The only way that we're going to get through this is, as you and I have spoken from the very beginning, is through the public's help. Social separating right now is going to help keep the numbers low or keep the surge from being too hard on the healthcare system. We had 10 cases today. That's the largest number we've had since the very beginning. I think it's very telling of what we need to look forward to through the next week to week and a half to really start thinking about maybe doing some sort of getting back, opening things up. And I think the governor's thinking long and hard about that. I can assure you that at the top levels here in our community, I know that those talks are going on.
Yeah, and I think something that's important that you and I talked about is keeping a sense of hope within the community too. Right. Even though we did have those 10 new cases of coronavirus in the Yuma County, bringing it to 42, do we have any confirmed recoveries? I think that also brings in a sense of hope. Anything like that that people can kind of know that's happening as well?
Well, certainly, we're not reporting recoveries, and we talked about that before, and the reasons why we don't necessarily go into it because it's not a solid number. We can talk about that another time, but there have been recoveries. I mean, certainly if there's only 2 options, either a recovery from the very beginning when we reported the first case back in March 20th, who was patient 0, all the way to now, certainly there has to be recoveries. Otherwise, the number of deaths would be much higher. So there's the math for you, and that's the stretch you can make. I think the greatest thing that people need to think about now or really focus on is the fact is that about a week ago we talked about the fact that there was community spread. And in fact, the 10 that you have today, 2 of them I believe we were able to map, the other 8, give or take 1 or 2, we haven't been able to map. And that proves to everybody within the sound of my voice that community spread is here, and we know it is, and every time you go outside into the public, every touch is a touch point, and you want to be cognizant of that.
Right, of course. Now, if someone that did not get a test done yet, but they did self-quarantine because they might have shown symptoms or not felt so good, what precautions should they be practicing if they think they quote-unquote had the coronavirus, especially since even testing here in this small community is, scarce in itself? So what should they be doing for themselves?
As we talked about, I think last week we talked a little bit, but the people are getting focused on that number on our website. Right now it's 42. We know that number is higher. We know that we've come in contact with, when doing the mapping, other people that are presenting symptoms and they don't meet the criteria to get a test. They are asked to stay at home, isolate, and stay in touch with their healthcare provider. Truly, the healthcare provider would tell them, okay, you're over, you're within a safe zone. So they need to stay in touch with their healthcare provider if they believe that they're displaying the symptoms and that they've been asked to stay home. Other than that, we've got the regular things that we've been talking about since day one. You've got to wash your hands. You've got to wash all the way up to your wrists. 20 seconds at a bare minimum. Cover your face with a mask, which is the new norm out of the CDC. Practice social distancing, all the stuff about going out into the public and really being rigorous. Again, folks, we're helping ourselves to help each other here. And that's the only way that we're going to get through this.
Right. And now shifting a little bit our focus to businesses in our area. I know you said the county has a small part in that, but what support are you guys providing for small businesses?
Sure. So we've been in touch with some of the local areas. The Chamber of Commerce is certainly one of them, and Greater Yuma Economic Development Corporation, and supporting them in their efforts to get information out to small businesses regarding small business loans and how to get through the paperwork. The paperwork is exhausting. It's mind-boggling. We've actually held some today, as a matter of fact, at 11 o'clock, we had a lunch and learn where the Chamber of Commerce, the GYDC, held about an hour-and-a-half long program on Facebook. We are bringing that into the television channel, Channel 77, and trying to get that information out as much as possible, get a widest dispersal of that information so that our small businesses that are hurting so bad can get the help that they need.
Right, great. And I think that the main message for today is, keeping that sense of hope, making sure that people are still practicing those social distancing skills, and, keeping our numbers as low as we can. Kevin, thanks so much for your time and for coming in. Again, we love having you here. For the latest on the cases in the county, you can visit our website, kyma.com.
Thank you.